So we're going to discuss a bit of a trauma to the C-spine. What I want you to do is just watch this and pause at various points so you can actually have a closer look and then continue through the video. So what I'm pointing out here is there's a vertebra facet joint displacement right about here. And this is on one of the sides, which is the left, and then you can see on the other side, which is the right. And then there's a little derangement at the vertebral bodies of C3 on C4 if you count them out. So pause there and count them. So in this particular image here, what you can see, I'm just going to pause myself, is there's a bit of a derangement at the lateral mass, the transverse process, near the transverse foramen. There's a bit of a fracture through there. And you can see that if you look at the markers that it's the left-hand side, the left-hand column that's happened with. So that's the pointing out the left side, there's a marker on there, and the yellow lines are just where we are in space. So again, this is the history, pause and read through, but it's a C3-4 fracture dislocation from a fall. So another good thing to point out here, and again, pause and have a good look, is that that's the vertebral artery on the right side, and then that's the vertebral artery on the left side. And on the CT angiogram, you can see that there's some loss of the flow of contrast. So left vertebral artery dissection from a C-spine injury or inner C-spine injury. Thank you very much. Like and subscribe.